Our next speaker is Dr. Robert Bright. He's been a member of the Mayo Clinic staff since 2007. He's Vice Chair of Education in the Department of Psychiatry and Psychology and an Assistant Professor of Psychiatry at the Mayo Clinic School of Medicine. He is the 2018 recipient of the Mayo Clinic Arizona Distinguished Educator of the Year Award. He attended the University of North Carolina in Chapel Hill for medical school, and his residency and fellowship in psychosomatic medicine were at the University of California in San Francisco. He directs the preclinical and clinical medical school education programs in psychiatry and oversees resident training for psychiatry, neurology, and internal medicine residents doing rotations in the department. He's a course director at the Mayo Clinic Psychiatry and Medical Settings annual course and a site director for the Mayo Clinic Communications and Healthcare course. Please help me welcome Dr. Bright.
Good afternoon, and let me extend to you what I hope will be one of many welcomes to Scottsdale by now. I was just talking with Jennifer. It's so surprising to us. We're freezing to death, and the people outside in the pool, it's so foreign. We're like looking for the ice cubes floating by them. But I was saying we've had guests from out of town, from the Midwest and from Montreal, and we feel bad for them because it's cold and chilly and gray and overcast. But then I see pictures of what's happening back there, and it's all put in perspective. So I'm going to talk this afternoon about the challenges of taking care of patients from a psychiatric perspective with complex medical comorbidities in the hospital setting or in the outpatient setting, but this will mostly be hospital-focused this afternoon. I don't have any financial disclosures. I am going to discuss some off-label use of medications for the treatment of delirium and anxiety. So we'll start with a case. A 34-year-old woman who's diagnosed 6 months ago with aplastic anemia. I want you to pay attention to the different diagnoses because they're each going to be pertinent as we're working through what we're going to do with her, because each creates a different challenge, which seems to always be the case these days when I'm seeing somebody. Aplastic anemia, seizure disorder, diabetic neuropathy, cirrhotic liver disease, admitted to the emergency room after she was found down outside her apartment by a neighbor, and she had altered mental status on arrival. And you're called in to, or you don't have a psychiatrist to call in, and she's delirious and agitated, and the question is, what do we do to help her? Her psychiatric history is notable for depression. She's had 2 near-lethal suicide attempts by overdose. She has not followed up with outpatient care. She has no history of psychosis or mania, and there's no family history of bipolar illness or psychosis.